Hello, welcome back, future nerds, to our playlist, to our video lecture series on communicable and infectious diseases. And for this video lecture, we are going to have leprosy or Hansen's disease. So, leprosy is a chronic systemic infection characterized by progressive lesions, cutaneous lesions, and this is again chronic and infectious and also communicable. Okay, um, usually there is no new case arising from previous contact, and majority are contracted in childhood, and this is based from one reference, and manifestations usually arise by 15 years old and definitely will be diagnosed by the age of 20 and older. It's not hereditary though, and it does not cross the placenta. Okay? So it is caused by a bacteria, a Mycobacterium leprae, and the mode of transmission is prolonged, intimate, or prolonged skin-to-skin contact. Okay. Other references would say in 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 hypothesis fomites, okay, but still not yet accepted. And some references would say it's a droplet infection also. Mycobacterium leprae is an acid-fast bacillus, same with tuberculosis bacilli. Um, uh, Leprosy attacks cutaneous tissues and peripheral nerves. It produces skin lesions, anesthesia effect, infection, and deformities. And really, these deformities are permanent, and it's not highly contagious, but and at the same time, it has a low infectivity. Okay, but once it attacks you and it makes you positive for leprosy and you have that manifestations, uh, it's really life changing, as I will show you some pictures later. um, Incubation period, it varies, but what I have found is usually it's 5 to 8 years, and modes of transmission again is respiratory droplets or inoculation through prolonged skin-to-skin contact. Cardinal signs usually is peripheral nerve enlargement, loss of sensation, or that's the anesthesia effect, and positive skin test for Mycobacterium leprae or Hansen's bacilli. There are types of leprosy. We have, this is from one reference also. We have tuberculoid. This is non-infectious, which is considered to be benign. Um, Short description of manifestations is it appears to be blotchy red lesions with anesthetic areas on the face, trunk, and also extremities. So the peripheral nerves are also affected, and sometimes the face, eyes, even testes for males. And it has a positive lepromin test. Um, this is non-infectious. If you study it in its diagnostics, only a few organisms will be found under microscope on those lesions. Okay. Second is we have your lepromatous type. This is an infectious one, also a malignant one. Um, this is the most serious and most infectious case based from one reference, and it damages the respiratory tract, the eyes, the testes, the the nerves and the skin, usually negative in lepromin test, but skin lesions contains large amounts of bacteria. There is gradual thickening of the skin, slow involvement of the peripheral nerves with some degree of anesthesia, and also loss of sensation, atrophy of the skin, and melting of small bones. Okay, that's the reason why they have deformities, because of this melting of the bones, okay, and of the extremities actually. And ulcerations can also happen in the nose, so the nose bridge is lost. Then natural amputation may occur because of the melting of the bones. Okay, and under microscope, getting samples from the lesions, many microorganisms are found. Then for borderline, it's in between tuberculoid and lepromatous. Okay, so it has the characteristics of both lepromatous and tuberculoid types. Other references also would present the manifestations in early and late uh, durations. Okay, so early manifestation, your signs and symptoms are color changes, which does not disappear even with treatment, muscle weakness and paralysis of the extremities, pain and redness of the eyes, nasal obstruction and nose bleeding. This is only early, okay? Loss of sensation, hair growth, and anhydrosis, some on some parts, and skin ulcers which does not heal even with treatment. Is those are early manifestations of leprosy. While for late manifestations, we have lagophthalmos, madarosis. When you say lagophthalmos is the um, loss of eyebrows. Then madarosis, oh, I should say lagophthalmos is inability to close the eyelids. Then madarosis, loss of eyebrows. Then sinking of the bridge of the nose due to absorption of the small bones or the melting. That usually happens not only in the nose but also in the fingers, ears. Then one of its characteristic manifestations, laying in face, chronic skin ulcers, contractures usually happen, or the clawing of fingers, and in males, gynecomastia is manifested. So these are some, okay, of the manifestations. Okay, so we have here the loss of the bones naturally, the contractures, the clawing of the fingers. Then we have here the lagophthalmos, inability to close the eyelids, as you can see in the pictures. We have here a madarosis, loss of eyebrows. We have here the leonine face, okay, as you can see. Okay. Then we have here the loss of nose bridge, then ulcers that do not heal or does not rest, do not heal even with treatment. Then we have gynecomastia with the presence of lesions on a male patient. So those are the manifestations, right? So you can better understand why it's said that it's life-threatening, it's deformities, and why it changes your life really permanently. Okay? And if you want to see other pictures, you may browse the internet or your books, okay, for more debilitating deformities. Then diagnostics, I will say descriptions to some. We have skin smear test, okay, and lepromin test, or skin lesion test. So for skin smear test, this is our skin test. This is used to determine what type of leprosy a person has, and it's safe and easy technique according to some sources, in which collection of sample is done from a tiny cut in the lesional skin or from the lesions, and it's stained and examined under microscope. Okay, and your skin smear test can be used as a diagnostic modality in the following disorders like leprosy. Okay, so this is a screening procedure for all patients in whom the diagnosis of leprosy is suspected. Okay, then we have lepromin test, we have Wasserman reaction tests. Then the therapy here is on Dapson or sulfone therapy, used also with rehabilitation activities, recreation activities, and occupational therapies. As you have seen, the effects of the manifestations, especially the natural amputations, are really great, are really life changing, as I term it. And these therapies are very important. Okay, actually, even psychological therapy is one, depending on the coping of the patient because of the body image disturbances or changes, and what society will tell, will say, will see on a patient with leprosy. Okay, and the fear, the stigma is believed to be there, especially those early times and before. Here in our country, there are leprosariums. Okay, there are leprosarium. Excuse me. Wherein the patients are being exiled or thrown, okay, on an island, on a facility, and decades or even years passed after many studies. It was found out that it can be treated in the community, in their homes. So these studies led to the therapies and the medications, okay, and hopefully decrease the stigma on or against leprosy or lepers, as we call the people or the person with leprosy. Okay, so it's a multi-drug therapy, MDT. It's combination of rifampicin, clofazimine, and dapsone for multibacillary type of leprosy, and we have rifampicin and dapsone for paucibacillary leprosy. And rifampicin is the most important anti-leprosy drug from one source. Okay. So we have treatment approach depends on microorganisms in the skin lesion. So whether it's few or many, so that's the basis of a paucibacillary and multibacillary leprosy, and the treatment is also based there. Okay, so paucibacillary has a treatment from one source, 6 to 9 months, rifampicin once a month, and dapsone once a day. And usually 6 months is enough once it's treated for dapsone and rifampicin. Treatment approach for multibacillary, rifampicin once a month, 600 milligrams, dapsone once a day, 50. Then clofazimine, lamprine once a day, 100 milligrams. Okay. Rifampicin and also dapsone. Actually, all of these three are antibiotics. Okay, and it's more effective when used in combinations. Okay, so just to watch out for renal and liver toxicity. For dapsone, look out for hemolysis. Dapsone is the mainstay here, considered to be important, most important drug and a permanent drug. For clofazimine, it can irritate the intestinal mucosa. It can have skin changes, especially red pigmentations. And usually multibacillary is really a long therapy, about 12 to 24 months, depending on the reaction, on the effect of the therapy, on the therapy. Then some additional management aside from really medications, psychological aspect of care, because patient may have low self-esteem, altered body image as seen on the pictures, and the social stigma that I was mentioning. Then we have skin care and prevent injuries, supervise patient with handling sharp and warm objects because they have loss of sensation. So assist them. Additional health education, provide adequate information regarding drug therapy. That's very important. The regimen, the duration, even the side effects. Okay, these are very important information in health education. Some reactions when on therapy, mild erythematous reactions, reddening in and around the nodules or the skin, edema, sudden increase in number of lesions, tenderness on the nerves, and your severe erythematous reaction, iritis, sudden paralysis, acute orchitis. Medications need not to be discontinued, but still need to be reported and need to be taught to the um, patients with leprosy or families with patients with leprosy. So health education is very, very important here. Again, psychological care is also a priority, and the social teachings and uh, inputs or insights against social stigma is also considered here. If you may want to verbalize, let the patient verbalize his or her feelings, that's a good way to do it also. And stand being an advocate to these types of patients or patients with leprosy. Okay, so that's the end of this video lecture. I hope you have learned something or refresh your minds from what your teachers have told you, what you have read also. So see you on the next video lecture. Thank you, and God bless future nurse or healthcare providers.